biggest advance in robotic surgery for urologic conditions has been the introduction of the XI robot. This robot has improved even further what we can do with robotic surgery. When I was trained in open, laparoscopic, as well as robotic surgery. This is the third edition of the robot that I've used. The comparison between the initial robot versus the XI robot is remarkable. The XI robot has 4 arms, where the initial robots had 3 arms. The field of vision of the XI is incredible. You really feel like you're inside the patient's abdomen. The width of the field of vision is amazing. I was describing recently operating on the SI versus the XI. The SI, I feel like I'm operating inside a box that's a little poorly lit. My arms are a little restricted, my vision's a little restricted, it's not really bright. The XI, I feel like I'm outside a box with beautiful vision. For kidney masses, we can see up and over the kidney, to the back of the kidney, which is very important if the mass is on the back of the kidney, or there's something we need to get to in a hard-to-reach spot, or there's difficult anatomy, or it's something deep inside the pelvis. The ability to see the high-definition, wide field of vision, the lighting, the 3D vision is remarkable on the XI robot. The precision of the instruments, the ability to change the ergonomics on the console are improvements such that I would estimate the time of surgery can be decreased by as much as maybe 30%. Additionally, the XI robot uses all 4 arms, including the camera, use 8mm ports. This is important because the prior robot, the camera was a 12mm port. So 8mm is about a third of an inch, 12mm is almost half an inch. The reason this is important is hernias. So when we're operating through with a 12mm camera port, it's very important to close that port completely. With the 8mm port, we still close it. But that difference, that reduction, that 4mm reduction, can significantly decrease the risk of hernias postoperatively, and also decrease the risk of pain, incisions, incisional pain, wound infections. And so being able to operate with all of the camera ports are identical improves the risk of hernia and risk of incisional pain. Additionally, if you want to move the camera to a different arm, you can, because all 4 ports allow you to use the camera wherever it gives you the best view of the surgical field.